Hello, everybody, and welcome to The Beautiful Struggle. I'm Aji Goodman.
I'm Jeremy Stiles.
I'm Brandon D. Coney.
Hi, everybody, and again, welcome to The Beautiful Struggle. Before we get into the program for today, we'll be talking about and discussing the health gap, why it exists. Let me first tell you what the Black Advancement is all about. Black Advancement Incorporated is a nonprofit organization that seeks to create unity within the Black community through action and dialogue, this being the dialogue portion. With all that being said, we will start with our first panelist of the day, Jeremy Stiles. Jeremy, take it away.
So before we got started with the recording, said this was a very difficult topic, the health gap. Part of it is just deciding what part of the health gap we were talking about. Are we talking about the access to healthcare, the outcomes, whether it be in particular health metrics, morbidity, so on and so forth. The biggest thing that struck me is kind of obvious, though, is that income seems to be the biggest factor, income and wealth. And that ends up being a cause for many of the gaps that we discuss. It's almost always the underlying factor as to why these gaps exist and persist. That's the big thing, is trying to tease out why something exists versus why it persists. Obviously, there's some of those obvious things from our legacy as a country due to racism, slavery, Jim Crow. But as far as the income, I'll just read a couple of things I found. So this organization, KFF, not sure what it stands for, but it says a broad array of factors within and beyond the healthcare system drive disparities in health and healthcare. Though healthcare is essential to health, research shows that health outcomes are driven by multiple factors, including underlying genetics, health behaviors, social and environmental factors, and access to healthcare. While there is currently no consensus in the research on the magnitude of the relative contributions of each of these factors to health, studies suggest that health behaviors and social and economic factors, often referred to as social determinants of health, are the primary drivers of health outcomes, and that social and economic factors shape individuals' health behaviors. Moreover, racism negatively affects mental and physical health, both indirectly and by creating inequities across the social determinants of health. I just wanted to read one other thing I found going with the income thing. Behavioral and environmental factors. This is from healthaffairs.org. Low-income Americans also have higher rates of behavioral risk factors: smoking, obesity, substance use, and low levels of physical activity, which are powerfully influenced by the more challenging home and community environments in which they live. For example, poor neighborhoods have a higher density of tobacco retailers, and the tobacco industry has historically targeted low-income people through various marketing strategies. And it goes on. So to me, the biggest reason why it exists is simply there's income and wealth disparities, and from there you can kind of expect that there would be a health disparity.
Man, very good stuff so far. That's a great way to start off. And everything, I echo everything that you said in terms of how difficult this topic was. Not so much because the disparity doesn't exist, it exists in such a wide way. And then it's like, how can I pinpoint like one specific thing that could make it be what it is? Of course, like Jeremy was 100% right when he's like, well, you can always go back to racism and segregation and so forth. Segregation being one of the bigger ones in this case, with the whole separate but equal rule that was passed, where that means that you would have to have a separate hospital, you have to have separate doctors and nurses and so on and so forth. But the equal part was never there. It was always less than a fifth of, a third of, so on and so forth. So as far as having equal resources, that part of the separate but equal law never seemed to take effect. You had a lot of bureaucrats that were within then a democratically held South that would purposely take things out of legislation in order to make it to where it doesn't help lower income people, but specifically Black people, because it didn't jive with the Southern way of life. So, I mean, like, there's a lot of aspects like that really played a factor in there. They did that through the New Deal. They did it through the GI Bill. They did it through a bunch of stuff. But as I kept researching, even after stuff like segregation, you have to look at things like, again, it does go back to economics, job opportunities. a lot of people get their health care and insurance and stuff through their employment. A great deal of people do, at least. So if you're at a job where they don't necessarily allow those things, or your education level has capped you in terms of what traditionally you would get as an occupation, sometimes those don't come with great benefits. Sometimes those don't come with great medical outcomes in terms of insurance and being able to go to the hospital whenever you want, or being covered for whatever comes up. That doesn't even count into the pre-morbidities of like diabetes, how Black people have more of that, have more hypertension, so on and so forth. One of the other things that the research kind of took me to that was really, really interesting was the idea that several of the states have refused to expand to Medicaid, which is something that could help out a lot when it comes to just people who are uninsured and being able to go see the doctor in the first place. And lo and behold, a lot of these places have a large Black population. Now, not all of them. There was Wyoming on the list. So we know that Wyoming probably does not have a huge Black population, nor does South Dakota. But other ones that are on the list is Texas, you got Alabama, you got Florida, you got Georgia, you got Mississippi, you got South Carolina and North Carolina. All of those have a significant Black population. And like it as it is with everything the Black advancement kind of focuses on, although we focus on just Black people for the most part, I mean, this is something that affects usually a wider array of them. It just affects us much more. It's a whole cold versus the flu type of thing when it comes to the Black community. So even though we're saying that about all these places, that still impacts older white people. It still impacts Hispanic people, everybody pretty much as well. It's tough. The last thing I'll leave on as far as the things that I found is the idea of how many people have private insurance. At least as far as the statistics say, in terms of 2022, 73% of whites had private insurance, to only 55% of Black people. So that's where my research kind of led me to. And that's where I'll stop. I'll hand it off to Brandon Coney now. Coney, go ahead.
Thank you, Audrey. I appreciate it. And I echo the sentiments of both you and Jeremy, you guys, with your commentary and also your research. I mean, it's pretty much the same thing that I found. One of the things that I found is that, the death rate for African-Americans decreased by 25% from 2015 back to 1999. Now, mind you, that's a good thing. But even with these improvements, new studies are showing that younger African Americans are living with or dying of many conditions typically found in white Americans at older ages. That was the thing that, both of you guys touched on. African Americans between the ages of 18 or 49 are 2 times as likely to die from heart disease than white people. African Americans between the ages of 35 and 64 are 50% more likely to have high blood pressure, than white people. And, the difference shows up, again, they say with Black people in their 20s, 30s, and 40s, for these diseases and causes of death. And with those types of diseases, when they start early, they can lead to death earlier. Chronic diseases and some of their risk factors may be silent and are not diagnosed during these early years. And that goes back to a combination of a lack of healthcare and a disparity in healthcare. And what it comes down to, again, is, economic and social conditions that are more common, unfortunately, among Black people than they are white people. I think I'd read that it said African-American adults are more likely to report they cannot see a doctor because of cost. It's the same old thing that goes down to all the times that all Americans should have equal opportunity to pursue a healthy life, but that's not always the case. The economic factors that come into play, the social stigmas that come into play. Jeremy pointed out the large number of access to tobacco and access to alcohol in Black neighborhoods contributes to these. There are lots of things that could be done, but I don't necessarily know if they will be done. Aji brought up the stance of Medicare being expanded in certain parts of the country to give people access to more healthcare. And I think that would help significantly. I just don't know when it's going to actually go about it. So some more research that I did, and it's just in comparison. For every 100,000 people, for Black people, the cause of death, it was heart disease, 1,086 compared to 928 for white people. So that's 43%, whereas white people is 38%. Cancer's at 29%, white people's at 20%. Strokes are at 41% for Black people, and they're at 38% for white people. You take that into account along with other social factors like unemployment, living in poverty. They even did studies on people with no home ownership, those who could not see a doctor, smoking, not active, and obesity. And in all of these categories, African Americans outweigh their white counterparts almost 2 to 1. And so, I mean, at the end of the day, I think one of the things that can be done is, the government and scientists continue doing their research to pinpoint why exactly these diseases affect Black people at higher disparity rates. And then also, making partnerships with community members and also educating Black people when it comes to actually their health and the importance of it. So.
Fantastic. So let's go on and move to our next portion, which is basically just the full discussion where we just talk this issue out amongst ourselves. I mean, like, what was like the most shocking thing that you found? I know that we all kind of probably are sort of familiar with the idea of the gap existing in terms of health, but what was something that where you came across and you were just like, that's unbelievable. I can't believe that that's something that we're going through now. Like mine was the Medicaid one, where although I knew it, it was like, it's different when you, like, although you know stuff that happens, it's different when you like look up the numbers for it and you're like, what in the hell is going on here? And you wonder why people are so irresponsible who are in leadership. So it's something that you guys came across that was just like, wow, what a music.
Aji, what was it? Aji, what was the Medicaid one again? What was
the Medicaid one? It was basically like there's like, was it 13? I want to say. Let me count. Hold on. Let me count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. There's 12 states that decided not, that refused to basically expand Medicaid, which means like they didn't even have to pay for it. Like the government pays for it. Federal government was supposed to pay for it. And they were just like, nah, we don't want it. And because of that, like a bunch of people who don't have insurance already and who possibly have jobs where they don't get that much health insurance either, they're basically kind of left out there more on an island than other states would do. So it's nonsensical to me. But
one thing that I found interesting was thing about the food deserts.
Yeah,
I'm sure y'all are both familiar with food deserts, and the idea has been, well, people in poor communities don't have the same access to healthier food, so then that results in poorer health outcomes. But I found multiple articles and research saying that that's not the case, that even when these communities get access to healthier food and grocery stores and supermarkets, they don't actually eat any healthier than they were, or that it's very insignificant of a change in their eating habits and what they choose to eat. So pulled up a couple. This was from U.S. News, just to take a quote from here. Negligible change says, we recently studied the impact of opening supermarkets and food deserts. Research conducted with, and then they name a few economists. From 2004 to 2016, over 1,000 supermarkets opened in neighborhoods around the country that previously had been food deserts. We analyzed the grocery purchases of a sample of 10,000 households living in those neighborhoods. Did they start to buy healthier food after the supermarket opened nearby? Although many people began shopping at the new local supermarket after it opened, they generally didn't buy healthier food. We can statistically conclude that the effect on healthy eating from opening new supermarkets was negligible at best. We calculated that local access to supermarkets explains no more than 1.5% of the difference in healthy eating between low and high income households. And it goes on with the reason. Just another thing was the difference that people in poor communities versus those in higher income communities travel for their groceries really isn't that different. So it says here, furthermore, local neighborhood conditions don't matter much since we
if something's free, then what is it really, you know, what do I really want it? So that, you know, how people think. But those are the two things that I came up with as far as that. And I appreciate you guys for saying everything you said, because I wouldn't have thought of it otherwise. Whoever would like to go next can go next.
I know that to that end, one thing that can be done, and we're actually doing this at my school, is introducing education to the kids as it pertains to health, wellness, and fitness. I believe it's twice a month. We have two different organizations who come in and they teach the kids about healthy eating. They teach the kids about being active. They teach the kids about making right decisions when it comes to food. To me, the only way it changes is if we start early. And I believe that programs like this can help with that. Will it combat it choline entirely? No, because again, you know, you're still going to have a lot of the issues that were brought up beforehand of the costs of food and or the access to proper healthcare. But I think that, you know, it all starts with education, educating kids and educating people. You start educating people earlier, then they start to learn better routines and better habits. So starting there, I believe is I don't want to say probably the only way that it happens, but, you know, again, it takes people overall do not like change. It's a proven fact. But if you get to somebody early enough, especially when they're a child, build the capacity in them for them to be able to think differently about their health, about their wellness, about that being a priority, then I think changes can be made. Will they take a while? Absolutely. I mean, this is a problem that's not going to be fixed overnight. This is a problem that's going to take decades. And, you know, Jeremy brought it up. There's an obesity problem in this country amongst all people, not just Black people, not the white people, it's all people. So it's really starting with teaching kids about the right things to eat, showing them the proper ways to exercise, and the proper ways to take care of their body. So we've got to start young. And I think implementing programs in schools, namely elementary schools, teaching kids the right way about their nutrition is one way to start.
Jeremy, on you.
I think that both the solutions y'all offered make a lot of sense. Healthier eating habits, trying to inculcate eating habits, especially amongst the youth, and sure, access to facilities and introducing kids to activities that get them moving more, all those type of things help people be healthier. Also, to Brandon's point about the price and the cost of healthier foods, one of the articles did talk about government policy as in taxing the processed food, the unhealthy food, and subsidizing the healthier things. And maybe that can go a certain distance in improving things. I think
they did that in New York, right? with the drinks, right? They did that in New York with like Coca-Cola or something like that. Right?
If they talked about it, did it actually go through?
I thought they implemented it. I thought they did. I would have to look that up. I'm sorry to say.
Yeah, but just to throw a little question out there, I know we're winding down, but all those things, they may improve health. They won't necessarily close the gap, though, because other groups' health can also be improving, right? So what do we really want? Like, if you had to choose between the two, would you rather the health gap between white and Black decrease by 50%, if you had to choose, or the health gap increase by 50%, but Black's health increase by 200%?
Go ahead, Brandon. I was going to say the 200%.
Yeah, I was going to say the 200% as well. Because doing the math, it's more people. But that was a great way to look at it, because I mean, this again, we're talking about the gap in health between Black people and white people. And wow, great way to ask that question. And I would also say I prefer it to be the 200%, because that just means that there are more Black people who are getting healthier.
Right. Yeah. That's fair. Hey, what a way to end it. Thanks a lot, Jeremy. I'm just like, I'm just joking, man. You know I'm joking. I'd like to thank everybody for watching. That's the Beautiful Struggle for today. You can see this and more Black advancement on shows and other things on our YouTube channel, or you can go to our website, which is www.blackadvancement.com. Till next time, peace and advance.